Hi, my name's Lis Osborne and I'm the Infant Feeding Coordinator here at Airedale, and I just wanted to take this opportunity to talk to you about how to position your baby, how to hold your baby for breastfeeding. So you may have heard of the chin principles. If you've had your baby already, I hope that you will have heard of those, but I want to just explain them more fully to you so that you really understand why they're important. So chin then is that word, and we use that C-H-I-N to describe the 4 different principles of positioning. And these are the things as the mum that you do for your baby, because your baby's going to find it quite hard to attach if all of these principles are not in place. So the first one then is C for close, and that's especially your baby's bottom that needs to be close. We don't want your baby to have to reach a long way to the breast, and your baby needs to feel nice and secure, so bottom really close. The next principle, the H, is for your baby's head, and that's really important that your baby's head is free to tip back. For a baby to be able to feed, we want them to have a lovely big wide mouth when they come to the breast. And if you're going to open your mouth wide, it's very hard to do if you tip your head forward, or even if your head's just in a straight position, it's quite hard. If you tip your head back, now you can open your mouth wide. So the head tipping back so that your baby can open his mouth wide and then swallow nice and freely when he's drinking the milk. That's really, really important. You can also imagine it would be quite irritating if somebody had a hand on the head, or your head, or a finger if you were eating and trying to swallow. So in much the same way, sometimes babies can get quite cross if we hold their heads. So be really careful that I'll just show you with my lovely assistant doll here, a lovely big C shape around the base of the baby's neck. And really important that you are around the base of the baby's neck. Try to avoid sneaking up to behind the baby's ears, because you can still actually manage to put quite a lot of pressure behind baby's head. And try to avoid bringing a sneaky finger up to behind the head. Again, you can see how that would tip the baby's head forward. So really important that I'm giving my baby lots of support, but allowing his head the freedom to tip back. We do worry about the baby's heads. In our culture, it's very common for us to think that we have to hold the head. But if I'm giving my baby some really good neck support, I am supporting the head. So don't worry too much about the baby and support. He will feel good if you hold him in that way. Okay, the next principle then is the I, and what the I stands for is in a line. So your baby needs to be facing your breast with his face square on, wherever your breast would be naturally positioned. So if your breast is naturally higher, your baby may be facing in this direction. If your breast is naturally lower, your baby will be much lower. But as you can hopefully see, the babies are facing the breast square on. And then what we want is for the rest of the baby then to be in a line so that he's not twisted. You can imagine yourself, you wouldn't eat your tea if you were sort of sat at the table all in a twisted way. It'd be very uncomfortable. So just the same for the babies. They're going to find it very hard to feed if their bodies are twisted and they're uncomfortable. So in a line is that principle. And then the final principle is nose to nipple. And this is with your baby's head already back, and that's really, really important. So with my baby positioned, the head's tipping back and his nose is opposite the nipple. And that's really important because that's about making sure the bottom lip is well below the nipple. You may be familiar with this leaflet. Hopefully you'll have had a copy of this leaflet. And in here, you can actually see where the baby's lip, the bottom lip, is aiming a good couple of centimetres below the nipple, because we want all of this lovely breast tissue to be on top of your baby's tongue as he's feeding, and we want the nipple to head to the back of the baby's mouth over the top of the tongue, where it's in a lovely safe place and it's not going to get any compression or any pain. So the nose to nipple principle is all about getting that baby's bottom lip in the right place. So with my baby's head back, his nose is opposite my nipple and his bottom lip is well below the nipple. Okay, so the final thing to say really about positioning is that there are lots of different positions you can use, but those principles that I've explained are always the same, because they're the things that your baby needs to be able to attach effectively. So this is the cross cradle hold. You could try an underarm hold, you could try lying down, you can even have your baby sitting up. There's lots of different positions, but the principles are always the same.